Alrighty, so Bridget's going to do some calf raises. So she's going to do the both directions, obviously. Up we go. And down. So generally I get people to take their feet apart a little bit further as well, so that the angle of the knee is tracking directly over the middle of the feet. So this is a good exercise to strengthen both calves. And then if you want to make it a bit more difficult, so Bridget's going to put, well, she's going to do 70% on one side, so especially in the case of ankle rehabilitation, halfway through, so she'll 30% on the bad side, and let's start that again. Here we go. Okay, now Bridget's going to demonstrate some calf raises. This is to strengthen the gastrocnemius and the soleus. So she's going to do 50-50%, so up and down. Okay, now to make these harder, we get people to do, we can hold a couple of hand weights, or you can use a backpack with some weights in it to increase the load on the calves. Another way to make these harder is if Bridget goes onto the step and she starts from below the step and then she comes up, so that's the concentric contraction. Then on the way down she comes down quite slowly, so that's the eccentric contraction. So that's especially important in activities that require jumping and landing to slow the motion down. See it a lot in AFL players, anyone who's doing jumping type sports. And you can increase the speed with that. Something sports related. You can talk to your physiotherapist about that, or your sports trainer or exercise physiologist. You can adjust the speed. Alright, so pause there. Okay, so this exercise is for during a period of rehabilitation when for an ankle or a calf strain. So Bridget's got her bad legs her right side and her good legs her left side. So she's putting most of her weight on her left side at the moment in order just to get the side that's been affected, the damaged side, used to doing some of this exercise. So she'd be putting about 30% of her weight on the right leg, which is the damaged one, that we've designated as the damaged one. Okay? Alrighty. And you can adjust speed with again. So this is a good one for later in rehab. This is a single-legged raise. Okay? Up and down on the single-legged. And of course you can do that on the step too. So Bridget will show that on the step. So you can use your back stairs. Okay, and that's really specific stuff. And you can adjust speed, etc. with that, length of time. You can add weights onto it, etc. Okay. Alrighty, so Bridget's going to demonstrate a plyometric type exercise. So this is sort of highly advanced ankle stuff. So what does the plyometrics do, Bridge?
So the plyometrics bring in your power, so the fast twitch fibers in your muscles.
Yep.
So they work on speed.
Yep.
And making your muscles more powerful.
You see how she's landing? So you can incorporate that with a leaping exercise. So Bridge is going to leap and then leap backwards. So there you go. I use the example of the AFL player landing. What else can you think of, Bridget? Other sports people that have
netball.
Netballers, of course. Major sports in Australia for females. There you go. So there's a little drill there. Now if she does two-legged plyometrics, so she's just going to skipping. So it's sort of like skipping. Skipping's a good exercise for plyometric work. She can do that unilaterally or sort of alternately there. Double-legged. Just double-legged. That's it. Up and down. So of course that brings in a lot of quadriceps and glutes and core stuff. So it's a good all-round exercise. to be included in the calf rehab. There she is. Alright, what Bridget is doing now is walking backwards. Now you mightn't have thought of this as an active type of stretch, but it's an active stretch for calves. So once again, she's landing on her toes and then extending back. So it's an active stretch, walking backwards. There we go, and she better stop there and turn around and go back up the hall and re-demonstrate. Find this especially useful when players are on the field or on the sporting arena. They can do some of these active dynamic stretches without stopping what they do. Very good. Thank you. Here we go. So Bridget's going to do very basic calf raise. So this is more soleus. I mean, obviously the gastrocnemius, the big muscle, does come in. But this is very early on in the piece for any type of rehabilitation, post-surgical or older people can do this, and it's a good circulatory exercise to boot. So that's pretty easy. Okay. Cool. Oops. Alright, so this exercise demonstrates the other part of the ankle, the anterior part or the front part. And what Bridget's doing is she's just drawing her toes back towards her so that that muscle at the front is working. Especially pertinent in neurological type rehab after people have had a stroke or they've had some sort of nerve injury, some sort of peripheral neuropathy, and rehabilitating the muscles at the front of the legs so that the foot doesn't drag and trip them when they're trying to walk. So if you imagine walking with a foot drop, so walk with a foot drop, that's it. The tendency to be to bring the leg out to the side, which causes other problems, or they'll trip over. So you need that, what we call dorsiflexion, to clear the foot in order for the heel to strike properly. Beautiful. Okay, so a bit more on ankle type rehab. Bridget's showing the balance board, so she's doing a side to side movement. And what that does, it activates a lot of muscles in and around the ankles and of course the hips and the knees. And what she's doing is promoting what we call inversion and eversion of the ankle. So the ankle going in is inversion, ankle going out to the side with the lateral border coming up. The outside border is called eversion. And then when you talk about the different types of strains, well, that's a different matter. But let's not confuse the issue. Now Bridget's going to do some dorsi and plantar flexion. So it's just sort of pointing the toes and then bringing them back. You can emphasise which part of the muscle you want to strengthen more by slightly moving the centre of the foot further on the board. Okay, so that's harder to dorsiflex, isn't it? So bring the toes back. So that brings in those front muscles more. And if Bridget moves backwards further on the board, so it's harder to plantar flex, so which is pointing the foot down. Okay, so that's some movement stuff. So the other things you do on the balance board is just balancing. So just balancing centre of gravity there. So she's got her eyes open, and now she's going to close her eyes, which makes balancing a whole lot more difficult. Try it without a balance board at home. What it does, it cuts out the visual feedback. So the brain, or actually the spinal cord, has to recognise where the foot is without the feedback of the eyes. There's another whole book on that too. Rightio. So now Bridget's going to move along to another little bit of equipment. A little disc, which is a plastic thing that's inflated with some air, not fully, and she's going to stand on that. So again, it's another level of difficulty. So you can, again, balance with that eyes open and eyes closed. Makes it a little bit harder. What this promotes is a thing called proprioception. Again, it's another little neurological term we use for the body's position sense. The body needs to know where it is in space and in relation to other objects, and so this retrains, well, especially the ankle, but of course it's bringing in the knees and the hips and the core. And then Bridget's is going to move over to the trampoline. It's another piece of equipment we use. There's too much light.
Running first?
Yeah, so Bridget's going to do a little routine on the mini trampoline. So she's just going to jog. Alright, so that's pretty easy. So we're going to intermingle the jogging with some double-legged bounces. That's it. So you see how it's bringing in a little about that plyometric stuff that we were talking about before, the landing, the eccentric control, etc. So she can do that with eyes open and eyes closed, of course, unless she falls off the back of the trampoline. And she can do that single-legged, of course, with eyes open and eyes closed. And she can do some calf raises, so two-legged calf raises. Again, it's a bit more difficulty than on the ground because it's an unstable surface. Again, with eyes open and eyes closed. And she can do that with a single leg. This will be fun. There we go. A lot harder again. You can see how hard that ankle's working. Get it right up. Need to work on that ankle, Bridget. And we can go back to a bit of jogging. Have a little break there. Give that muscle a bit of a break. That's it. We'll do some star jumps. So we'll do some lateral star jumps. We'll do some forwards and backwards ones. There you go. Very good. Alrighty. And if we want to be really technical, let's